Michaela, Director of the European Cancer Patient Coalition. Cancer patients are the new big actor at the European level and national level. What are the key issues for cancer patients?
Well, now we are having our annual General Assembly from today until Sunday, and we put indeed on the agenda what we think are the hot topics for the moment. So the main theme is cancer survivorship, and what can we do to help cancer survivors to reintegrate into the workforce. We will talk about the need of having a national survivorship plan. We will talk about all the developments in Work Package 8 of Cancun. Then we also believe that HTA is very important for the moment. It's a lot going on, but many of our members don't know that much about it. So at national level it's not that well known. So HTA is the second main theme of the session. Then we have a lot on mHealth and also on rare cancers and the role ECPC will have in the joint initiative on rare cancers.
Molecular biology has taken a very basic angle to science and has lots of implications for personalized medicine too. So we are trying to understand in molecular biology basic processes in a cell, basic molecular processes, for instance such that concern the DNA. And we are also trying to understand disease processes and hence implications for personalized medicine. Disease processes are often modulated by what's happening in our DNA, in our hereditary code. Little differences in the code are responsible for why some of us get diseases early in life, some get them late in life. They also determine to some extent how treatments will work individually in people. These are some of the things that AMBO researchers are concerning their research about.
You've inspired many in a conference today on personalised medicine to take action. And you outlined 4 areas, not 3 areas, but 4 areas. Yeah. What are these 4 crucial actions that the EU should take and also member states should take to support better development of treatments and diagnostics for patients?
Yeah, there's 4 advices that are brought up. The first one is put different people in a room. If you have not solved the problem in the past 30 years with the same group that you're going to work with the next 10 years, you will not solve the problem either. So I think put different people in a room means people with different backgrounds, with different opinions. The second advice is go for the root cause. Really go for what is the truth, what you think is the truth. That's why you need people with different opinions. To challenge your opinion, go for the root cause. And the third advice is scale fast. So think big, start small, and scale fast. But by scaling fast, you bring it in with a greater speed to the people who need it, to the patients. And the fourth is, well, like I told this morning, the fourth is be independent. And that's, I think, the most hard thing to do, to be independent, because we all have an income, we all have people we work with, etc. But being independent means that you really can do the things that need to be done to solve the problem. And I also always work in the world of cancer, but you can tell this about other serious diseases as well. So 4 advices: put different people in a room, go for the root cause, scale fast, and be independent.
Well, I think the European Cancer Patient Coalition is the one place where we know that the patients will be the centre of it, because we are all patient advocacy organisations. I mean, from our side, we are a charity, but we are totally run by patients and carers, founded by patients and carers, run by patients and carers, and always will be. So we are the voice of bladder cancer patients from the UK. We're now working on the European level so that we can unite all the bladder cancer patients across the whole of the European community to work together to get better prognosis, better treatments, better diagnosis and prevention for bladder cancer across the whole of Europe. And if we work together, we can achieve it. And the ECPC is one of the mechanisms that we know that will help to achieve that goal.
You are the integrator of all your personal data. Not even Google knows all the data that you could possibly integrate. And this is a huge asset that we so far haven't used. And the greatest asset is the more you can integrate this data, the better, the more value you can generate for the healthcare system, for global health in general. But we don't want this to be handled by sort of multinational companies like Google, but we want to have data banks that are actually owned by the citizens themselves. And the cooperative is the one member, one vote principle. And it fits so well because we all have the same amount of personal data. You and I are billionaires as every woman in Tanzania in genome data, right? And so if we have these data banking infrastructure where you can store your data like your money in a safe environment, and you can take it or share it with whomever you want, like you do now with a bank teller, then we are creating a data economy.